me. So I am a prescribing and care home support dietitian, and I recently started in July, so I might have met some of you along the way. But just to go a little bit about the area that I cover and sort of the services that I can provide so that people can get in touch with me if they want to. If we could just go to the next slide, please. Perfect. So I cover just Crawley, Horsham and Mid Sussex, so Burgess Hill, East Grinstead and Haywards Heath. Unfortunately, there isn't an equivalent of me in coastal West Sussex, but hopefully with some of the work that I do to sort of show how important it is to have a dietitian that does the role that I do, hopefully we'll be able to get some funding for a dietitian who does something similar down in the coastal area. So I cover any GP practices within the Crawley, Horsham and Mid Sussex PCNs, so primary care network. A primary care network, just for those of you that maybe don't know, is just a group of GP practices working together with a range of local providers to offer a more personalised, coordinated health and social care to their local populations. So you'll find different groups, and on the screen there it just shows. In terms of care homes, I cover any care home residents that are registered with those GP practices within those PCNs. So I've definitely met some of the care homes already. I've been out to visit a few. I've had a few online meetings with some people, so it's been nice to get to know everyone, but just trying to reach the wider crowd as well by doing this today. If we could just flick onto the next slide, please. There we go, it's going. Perfect. So just a little bit about my role. So I think it's split off, cut off at the top, but I'll explain what that says, so don't worry. So my role is split in two, so at the top it's just missing a line there, and it's missing a line at the bottom as well. I don't know what happened, so half of my time is spent with the meds optimization team. So half of my time is spent with the meds optimization team. I work full time, so I do 2.5 days a week with them. That's based with West Sussex CCG, but I still do only cover Crawley, Horsham and Mid Sussex for that. And what I do is I sort of try to influence appropriate and cost-effective prescribing of nutritional products through GP audits. So that's really the main point of my role, is to try and provide education about appropriate prescribing of nutritional products through education. So I identify patients and residents receiving prescriptions of nutritional products, and then I provide appropriate advice based on sort of what I find in my assessment. I work quite closely with the meds optimization team in care homes. So the MOC team, they're quite often referred to. So I have a close relationship with them, and we go through things together. And if they do medication reviews for your care home, and they have any nutritional queries, then I'm the person that they come to ask. And then what I'm also trying to do is do some training with the GP practices to provide education around appropriate prescribing, the guidelines, what's recommended out there, and I also can provide resources. So that's kind of the meds optimization side of my role, which doesn't necessarily have much to do with the care homes. So then the other half of my role is that I work with as part of the Enhanced Health and Care Homes team. So that's with Sussex Community NHS Foundation Trust. And I lead on the training and education of care home staff to help improve the nutritional care for all care home residents. So I also lead on the Nutrition and Hydration Champion Network within care homes. So I had a meeting back in September with the existing champions. So some of your care homes might have been there. I support staff by responding to queries related to specific residents with tailored advice. So that's just really important to know, is that I can answer specific questions about a specific resident. You can just, if you don't have an NHS email, you can just leave out the patient's name and any details. You can just put the scenario to me and I can help. And that might be patients who have left hospital and they're a new resident, or various things. I'm going to touch on that in a bit. And I also have a close relationship with the care home matrons who I work with quite a lot. So in terms of the audits that I do, once a patient has been, or a resident has been identified, I might end up doing a little review to see if the prescription is still appropriate, and that will be documented on the GP system. I cover 35 GP practices, so it's a massive task, and within those 35 GP practices, I have about 115 care homes. So I am working around slowly, and hopefully I will get to all of you at some point. But just bear in mind that, you know, there are a lot. So if I'm not in touch immediately, then that's probably why. But you can always ping me an email if you've got a specific question. I'm just reading my notes to check I haven't missed anything, so just bear with me. When I come out to the care homes, it will be bespoke training. So I'm actually going to flick onto the next slide now, if possible, just to go into the care home side of things a bit more. Thank you. So for the training side of things, I'm setting up training in two different ways, just because it seems to work differently for some care homes, is what I've picked up since I've been here. So I'm going to do some rolling virtual training on various topics related to nutrition and hydration, and that's going to be every 3 months. I'm going to send the invite to all care homes, and topics can include various things from catering, diabetes, dementia, many more, COVID, must training, malnutrition and dehydration, lots of different things. So my first session I've put in the diary is for Thursday, the 25th of November. That session is going to be in the morning from 10 till 12, and the topic is going to be preventing undernutrition. So if you all want to pop that in your diaries, yeah, and then you'll all get the invite nearer the time with the link to join. It'll be on Microsoft Teams, and then that'll be a 3-monthly rolling thing. And I'm happy to take feedback at the session before as to what people might like to see coming up for the next session. So one thing that's really nice about this role is it's changed a lot since my predecessor left. And so I've got quite a lot of freedom to tailor it to what people ask for. So do let me know, because I can build that in, just important to remember. So the training that I'm going to come out and do actually in the care homes, face to face, or it can be virtual. So I've done a mix of both. So that's going to really happen when somebody approaches me and says, can you come in and do some training for me on this topic or that topic, whatever it might be. And that's going to be a really bespoke session with bespoke resources for that care home. It can come from the care home themselves coming to me and saying, can you come in and do some training? I also will try and engage with care homes that are highlighted to me by various people. So it might be that the mock team highlight a care home to me. It might be that the GP highlights someone. It might be other dietitians. So I'm part of First Community, and we have a dietetic service that covers some of the same area that I do. So they might say, oh, there's a care home that's got a lot of requests for nutritional supplements. Would you be able to go in and do some training with them? So can sort of come from anywhere. Or it might be the care home matrons or the chefs. I've had lots of different people approach me. So that's just a bit about that training. So that's a bit more bespoke and not quite so broad. It'll be tailored to that care home as to what their needs are. And then there's also the Nutrition and Hydration Champion Network. So if we flick onto the next slide. So the nutrition and hydration champion was set up by the person that did the job before me. And we try to encourage every care home to have at least one nutrition and hydration champion, if not two, ideally. And when you become part of this network, you will be invited to meetups, which happen twice a year with all the champions, and you'll also get a quarterly newsletter. If you haven't got a champion or you want to nominate someone to be a champion, you can just email me and I'll add them to the list. So when somebody's a new champion, I do some initial training with them, and it's about a 3-hour session. It's quite long, and the next one's going to be in January 2022. So please do let me know if you want somebody to be a new champion and to come onto that training. For the foreseeable future, it's going to probably be virtual. I am looking into options for face-to-face, but it's just proving to be a little bit more difficult in the current times. And then, as I said, it's followed by 2 meetings in the year, which will be a 1 to 2 hour session, so a bit shorter. I had one about a month ago, and the next one's going to be in March of next year. And then there's a quarterly newsletter. So I've already done one for July and October, which hopefully, if there are any champions on the call or any care homes, you'll have seen them. I always copy in the managers to all of my communication for the care homes that do have champions as well. So I like to have direct email addresses for the champions, but sometimes that's not always possible. So then I copy in the manager to pass on to the champion. I'm also in the process of setting up a communication forum, because that's something that cropped up in September. So to share success stories, to ask questions where everyone can see them, everyone can reply. So just a bit of a support system if there's any queries or if somebody wants to share something. So hopefully once we get that sorted, I'll be able to update that network. If we could flick onto the next slide, please. So just a little bit. It's probably the sideways screen playing havoc. I'll carry on talking while that just gets rectified. It's not a problem. So just
bear with me. Sorry, I was trying to unmute myself by pressing the space bar, and the space bar advanced the slides. So we were going on to patient specific.
That's it, yeah.
So slideshow from current slide. I have to end the other slideshow now. Oh, I'm really sorry, Lucy.
Oh, that's all right, don't worry. Technology, it happens all the time. Every presentation I do, something happens, so don't worry, honestly, it never goes smoothly.
Right, let's get rid of that one. And so we were back to what I was going to ask you. The reason I was trying to unmute myself was when you're talking about champions getting involved in various things, presumably that's just, again, people in the areas that you described at the beginning. It's not, if you're coastal, then
no, unfortunately, it's just in what we call the North Patch of West Sussex. Okay. I am trying my hardest to work on the CCG and getting them to employ somebody similar to me within the coastal area, because it's a really big patch that needs the support. But unfortunately, it's not happened quite yet, but hopefully at some point.
Okay. Right, have you now got the correct slide showing or not? I'm not sharing it at the moment, so I've got the right slide there. How's that?
Yeah, perfect, brilliant, thank you. So just a bit about the patient-specific advice that I mentioned. So most of you will know there's very limited dietetic service for care homes across West Sussex. So I can provide tailored advice in relation to queries about prescribed nutritional products for specific residents. I am also happy to give advice to sort of general queries to the coastal area. I've had a couple of people approach me and ask questions. So for example, I work very closely with the meds management team, as I mentioned earlier, and one of the pharmacists emailed me about something down in the coastal area, but she just needed a little bit of advice about what to do with somebody's prescription. And I'm more than happy to answer a question in an email about something. It only takes me 5 minutes to respond. It's not a problem. Or I can point you in the right direction of somebody that might be able to help as well. So I'm just a bit of a point of call for everyone, really. But for my area, I can provide tailored advice in relation to queries. So for example, somebody asked me about a resident who would only drink coffee and eat biscuits. That was it. That was all they'd do. And they weren't really sure what to do. So I gave them some advice about things that they could do with that. So the queries can come from the care home staff, GPs, pharmacists, care home matrons, pretty much anyone who's got a question, just pop me an email. It's not a problem. So something really important to remember is I don't carry what I call a patient caseload. So I don't see patients, I don't regularly review patients. My main aim is training and education. So please don't refer patients to me because I won't come and see them. You might get somebody being reviewed as part of one of my audits within the GP practice if the care home is associated with that GP practice. So I'm about to hopefully soon be doing a GP practice at Langley Corner in Crawley, and I believe there's 2 care homes that are associated with that GP practice. So their residents, if anyone's on a nutritional product, their residents will get a review, so they'll probably get a phone call from me, but it's very specific about their nutritional products that they're prescribed. It's not about, and when I'm talking about nutritional products that are prescribed, I'm mainly talking about nutritional supplement drinks. So your 40 sips Fresibins, AIM Shake, Food Link Complete, things along those lines. But what I can do is if you don't know who else to message and you message me about a patient that needs a review, I can point you in the right direction of the local dietetic service for that team, for that care home. Like I said, there is a real lack of dietetic provision in care homes across West Sussex. So that's coastal and Crawley, Horsham and Mid Sussex. So I am keeping a log of all the queries that come through and the ones that won't be seen by the dietetic service to try and highlight the lack of service. So I'm trying my hardest to get some proper dietetic cover for you guys because it's so important and it's just very under-recognised at the moment. So I can, in terms of just supporting the patient-specific advice, I can provide resources, guidelines, pathways, contact details for the community dietitians. And yeah, like I said, you might get contact from me just doing an audit review, but that won't be a regular review. It'll just be a few questions over the phone. Next slide, please. Okay, so just my contact details. So hopefully for the care homes in Crawley, Horsham and Mid Sussex, hopefully you have been receiving my email communications. I've sent out quite a few. You're probably getting bored of hearing from me. If you haven't heard from me, please jot down my email address and my telephone numbers at the bottom. Please let me know and I can update your details on my distribution list so you do get included in the communication, so getting invited to training and things like that. Please feel free to contact me with any queries, any training requests, and send any details of any new nutrition and hydration champions for your care home. And there's just one more slide that says thank you. And does anybody have any questions?
I think there were a couple of questions I've jotted down.
Yeah.
One from Karen Stevens at Skills for Care, and just wondered if you're picking up any issues with peg feeding training and competencies.
So I don't cover peg feeding, but I can point you in the right direction of somebody who might be able to help with peg feeding. If a resident is on a PEG feed, they will have a better dietetic service than somebody who's not on a PEG feed. So there will be a dietitian associated with that patient. So if you ping me an email, I can point you in the right direction of the dietetic service, and I can also put them in touch with the home care nurses who can help with training and competencies.
Thanks, Lucy. Could you put your email address in the chat? Is that
Of course
possible?
I can, yeah.
We often do get inquiries about how people access, particularly the competency sign-off.
Okay.
Thank you so much.
There you go. I've just popped it in there for you.
And just another couple of questions about if there's a service or if you cover either home care or supported living.
So I don't, unfortunately. So I don't cover supported living, and I don't. So patients who are at home, they will get seen as part of my audits, but again, I don't cover patients who are at home. So there are limited. So the way the dietetic services work across West Sussex is, this applies to both coastal and Crawley, Horsham and Mid Sussex, is there is a dietetic service, and they will go out to somebody's home or care home if they have a PEG feed or any kind of tube feeding. So they will get home domiciliary visits, whether it's at home or in a care home or a nursing home or supported living, they will get seen. And anyone else who doesn't have a PEG has to attend an outpatient clinic. So this is where care home residents, it becomes a little bit tricky for, and because they can't attend a clinic most of the time, it becomes very difficult. So then they might get telephone review. The waits are very long, the team is really small, it's a really big issue. So hopefully we'll get a bit more provision as time goes by. But yeah, I don't cover, I will cover people who are at home and people who are in supported living, but I don't go out and review them. They'll just be as part of my audit. It's the same whether they're in a care home, a nursing home, a residential home, supported living. It'll be just part of my audit rather than actually reviewing them. Does that make sense? It's confusing. It's taken me months to get my head around it.
There is just one little last query. Just if you're in contact with the West Sussex County Council Care and Business Support Team, and if not, we can send you their details because they would be a good point of referral.
Yeah, that'd be brilliant if you could send me their details. I think it was Karen Perks who put that in. If you could pop it in the chat, I'll make a note of it.
Thank you.
Lovely, that's really helpful, Lucy, and hopefully we can get somebody doing something equally supportive in the coastal region.
Yeah.
I'm going to move us straight on to the next speaker, which is James Sage from Royds Withy King, who's kindly talking to us this morning about vaccinations. Hi, James.
Hi, Tom. Thanks very much. For those of you that don't know me, I'm James Sage. I'm an employment lawyer and head of the Health and Social Care team at Royds Withy King Solicitors. I'm just going to give you a kind of an update and overview of the mandatory vaccination position. Obviously, this applies only to those of you that are running care homes, but I think it is equally important for those of you running community businesses, because it seems likely that this is going to be extended to you. So I think it's also, there is also some relevance there for you. I'm not going to go through the full detail of the mandatory vaccination regulations, because I'm sure that those of you that are caught by this are well into your processes of implementing mandatory vaccination. What I wanted to highlight was some of the kind of key outstanding issues and questions that we're helping providers with at the moment, because I think that those probably will be relevant to you as well. So if you have any questions, there will be time at the end. So I've allowed enough time to do that. So the first thing I suppose to start with is the medical exemption. So we have finally got some guidance on that. We actually have two sets of exemption processes currently. We've got the temporary medical exemption process, whereby an employee who thinks that they're medically exempt can self-certify their the fact that they think that they're exempt. And that will give them an exemption until the 23rd of December. In order to do that, the Department of Health and Social Care guidance provides a specific self-certification form for them to complete. This also applies to staff that are pregnant, which is causing some confusion because the government guidance is that if you're pregnant, you should be getting the vaccine because the health consequences for you as an individual are potentially quite severe if you're not vaccinated. But at the same time, they've now made an exemption from mandatory vaccination for staff who are pregnant, which I think does make it a bit more difficult for you as managers trying to implement this. But it's important that you update the conversations that you've had with pregnant employees so that they are aware that they can now choose to exempt themselves temporarily if they want to do that. It's for the employee to self-certify. You don't have to ask for any information about their medical position or assess what they're saying. They just need to confirm that they believe that they've got an exemption. The form that they're required to sign states that it's and the guidance states that it's a non-exhaustive list. So you just need to be careful not to impose any limitations on that, because there are some examples of what might amount to a medical exemption. But given that the guidance expressly states that it's a non-exhaustive list, I don't think you as a provider can start saying, well, this doesn't sound like it's on the list. And so we don't think that you should you should get an exemption. At the same time, we've now got the formal exemption process. So that was launched about 2 weeks ago, I think. And that involves an employee who believes that they're exempt calling 119. They will get an application form sent to them, which I think then goes back to either their GP or a clinician, and then they'll be sent an outcome. And there is no right of appeal against that decision, which is one of the things that we thought could potentially create difficulties from a timescale point of view if there was a lengthy appeal process as part of this, but there isn't. So a couple of things to note from the medical exemption process. If you have staff that are wanting to go through the exemption process, some might be, now that the formal process is open, just doing that rather than completing the temporary exemption process. But I think you should be urging staff to complete the self-certification form as well, because they will only get the extension until the 23rd of December if they sign the self-certification form. If they just go straight into the formal process, calling 119, then they will need to have an outcome from their medical exemption by the 11th of November. They won't be able to enter the care home after that date if they haven't got it. And the government is saying 2 to 3 weeks to get an outcome. That seems, given the potential numbers involved and the busy workloads of GPs, that seems quite ambitious. So if it does, given that that's probably the period now, there's only a month now until the 11th of November, or slightly less. I think we need to ensure that those who want an exemption are signing the self-certification form, and it just buys you a bit more time then to deal with it. And also what it will mean that is if someone comes back and they aren't exempt, and they're refusing to have the vaccine, there's still time to go through that dismissal process and give them notice and time for them to work their notice before the 23rd of December. And that will minimise the risk of expensive payment in lieu of notice costs. I've spent quite a lot of time this week actually dealing with correspondence from a particular union called the Workers of England Union, which I hadn't really heard of much prior to mandatory vaccination, but have emerged as the champion of people who don't want to be vaccinated in care homes. And they are advising their members to refuse signing the temporary medical exemption form. They have set out some reasons in an email to me why that's the case, but I have to say none of it really made a huge amount of sense. So I'm not entirely sure what their justification is. But they've created their own form and they're telling their members to sign this form to get a medical exemption. We've, through advising some providers, we've asked CQC what their position would be on this, and they've said that it wouldn't be acceptable to sign a different temporary medical exemption form. It needs to be the Department of Health and Social Care form. So if you receive one of these, that seems to be the position. This also has now, we've also now asked for this to be raised to the Department of Health and Social Care, and I understand through the Care Association Alliance that the Department of Health and Social Care are not particularly happy about this, and they're in the process of writing a letter to the union saying that they need to stop doing that and that it wouldn't be a valid form. So as I said, I've probably advised 4 or 5 providers this week that are in that situation. So it's just something to be aware of if you get that. We've also got this kind of outstanding issue relating to staff that have been vaccinated overseas. So they have a temporary exemption until the 23rd of December, but there's currently no formal process as there is with those with a medical exemption in place. And so we hope that there will be a formal process in place between now and then. But as it stands, they need to submit a self-certification form. There's a separate form attached to the Department of Health and Social Care guidance, enabling them to self-certify that they've had a vaccine overseas. Something else that we've been helping a lot of providers with is kind of grievances and complaints about mandatory vaccination. And some of these, actually, in fact, the vast majority of these, if not all of these, are either written by unions or some third party, very lengthy letters raising lots of legal arguments about the validity of the regulations bringing in mandatory vaccination. So in terms of how you deal with these, I think the first thing is just make sure you separate any personal complaints that are in that letter, because those you will need to, so anything that's specific to the person that's raised it. So you will need to deal with those as a grievance and deal with those in detail. But to the extent that you receive a letter which has got 4 or 5 pages of arguments suggesting that the regulations are a breach of human rights law, other acts of Parliament, and that I've seen many of these. I think most providers I'm advising have received at least one of these letters, and there's about 5 or 6 of them in circulation. I think your response to that needs to be that ultimately you're not in a position as a provider to respond to constitutional law arguments about the validity of these regulations. The regulations are law, and you have a legal obligation to implement and comply with them. And so rather than getting bogged down in all the detail of responding to these legal arguments, the best thing you can probably do is just say, that one line saying, we can't comment on this. It's ultimately the regulations are in force and we have to comply with them. As soon as you start, there are some good arguments in response to some of the points that they're making, but as soon as you start engaging in those, then it's probably going to be a never-ending process. So it's probably just better to stay clear of it in the first place. From a timescale point of view, we have had quite a few questions about whether we think it's likely that the 11th of November date will be pushed back. And I think we don't know for sure. And with this government and its history of U-turns, you wouldn't put it past them. But if you look at the comments of Sajid Javid in the last couple of weeks, he is taking a very robust line and effectively saying, if you don't want to be vaccinated, then you need to get out and get a job somewhere else. So he's not showing any real sympathy or kind of understanding for care workers who might be hesitant. And I think that probably means it's unlikely there's going to be any pushback to that date. One of the other questions that we've received quite a bit recently was about whether there needs to be a gap between the second vaccine and then someone coming back into work after the 11th of November. So I think the guidance is that you only get the full benefit of both vaccines after a 14-day period. And some providers thought that meant that you needed to have had the second dose at least 14 days before the 11th of November. But that's not the case. The regulations only say that you need to have had the second dose by the 11th of November in order to enter the care home. So just to clarify that. So they could have their second dose on the 10th of November and that would be fine. It would be quite helpful if there was more availability of the vaccines which only require one jab, particularly for those who are late adopters of vaccination, people who have just are late in the day of changing their mind. But also, I think going forward, recruitment, as we all know, is a nightmare at the moment. And I think it's going to be made even harder by the fact that if you've got people coming to the sector, particularly young people, for example, who might have been late in the day of having the opportunity to be vaccinated. If they're coming for jobs and you're saying to them, well, you're not vaccinated, so you've got to wait 8 weeks before you can start work, in all likelihood, they're going to go to a different sector and get a job where they can just start earning straight away. And so I think we do need to move to a position for the care sector where we have this one jab option, so that there isn't a significant delay, and you can just get people straight into work. As you've probably heard, and as I alluded to at the outset, the government is consulting on extending this requirement to the other parts of the care sector, so domiciliary and supported living and community care, and also to the NHS. That consultation ends on the 20th of October. And obviously, if implemented, and again, the sounds we're hearing from Sajid Javid suggest that this is probably likely, then this is going to create really significant challenges in the sector, because what the difficulties we're already seeing with recruitment will inevitably be exacerbated if the same requirement applies to dom care and supported living as well. The one benefit, if it's introduced to the NHS, would be that the current position of unfair competition between social care and NHS, only one part of those two being required to vaccinate, with the result that staff are moving from social care to the NHS to avoid vaccination, that would close that option, which might be helpful to care homes in particular. And we've certainly been advising a number of providers who have incurred significant cost recruiting nurses, and including nurses from abroad, who now don't want to be vaccinated and are just filtering into the NHS, which is obviously pretty damaging for the sector. From what we're hearing, I think most people, from what we're hearing, we think it's likely that this will go ahead. But I think what we're hearing through the Care Association Alliance, and Melanie Weatherly in particular, is that it'll probably be in the new year rather than this side of Christmas. As part of that consultation, the government's also trying to impose mandatory flu vaccination, including for care homes. And my experience of that is that care staff have typically been quite reluctant to be vaccinated against flu in the past. And the concern is that even if there's a small percentage of staff that are not willing to have mandatory flu vaccination, that will have a further negative impact on recruitment and retention of staff in the sector at a time when it's already pretty precarious. And I really do think that some staff will take the view that with the COVID vaccine, that is a public health emergency, where there's been a high rate of deaths in a short period of time, and so you can understand, some people can understand the need to make that mandatory. I don't think those arguments work with the flu vaccine in the same way, and so I can see the likelihood of hesitancy there from staff. One of the other things that we've been asked quite a bit recently is about this the situation you could end up in, where there's a kind of conflict between the regulatory requirement to ensure that your care home staff are vaccinated and the regulatory requirement to ensure that you have sufficient numbers of staff to operate the service, and particularly where you've got potentially 10, 20, and we've seen numbers higher than that of staff potentially going to have to be dismissed because they're not willing to have the vaccine. CQC say that they will take a proportionate approach, but I've spoken to our regulatory team, so I've got colleagues who are dealing with CQC enforcement and inspection work on a daily basis, and their view is that that means that they may not go straight to very serious enforcement action, but it will be enforcement action. There won't be a let-off for not complying with the regulations, and so we'd kind of urge you not to think that that is a realistic option, which obviously does create some challenges. If you are in that sort of situation, I think the best you can do is build a strong case to show that you've made every attempt to recruit and what those challenges are, to replace those workers, and also the attempts that you've made to find vaccinated agency workers, which again at the moment is quite hard as well. But I think that's probably as much as you can do to influence the proportionate approach that CQC say that they're going to take. CQC are also saying that they're going to be using the capacity tracker data to trigger CQC inspections. So if the date, if coming up to the 11th of November, they can see that there are care homes with low vaccination take-up, in all likelihood, they're probably they're going to be the target for inspections shortly after that period. So that's just something to be aware of. And I think that this may now be that, given the really significant challenges with staffing, now might be the time to consider removing the restrictions on the movement of staff, because the conversations that we're involved with at a regional and national level are about this becoming a business continuity issue now for some providers. It won't be that for everyone. I totally appreciate that, and for some, actually, vaccination isn't going to result in a significant loss of staff. But overall, we run the risk of losing a very significant number of staff from the sector, and that will have a knock-on effect for everyone, I think. The government's estimation was that 40 to 70,000 staff are likely to be dismissed because they don't want to have the vaccine in a sector where there's well over 100,000 vacancies already. And from a government perspective, there isn't a solution to plug that gap. So I think some thought needs to go into how we're going to try and manage that. If you are dealing with mandatory vaccination and you have any other queries, feel free to give me a call. Obviously, we partner with the association, so if you want to just call me for a chat to run something past me, feel free to do that. We're very happy to do that for members. If you get to the point where you are potentially having to terminate employment because people aren't willing to be vaccinated and you need help with that process and the correspondence with staff, again, we can help you with that. So that's all from me. I'm very happy to take some questions if we've got them.
Thank you, James. There's a really interesting one, quite valid actually, is what happens after the 23rd of December for pregnant workers, and will the temporary process become void after this date? So pregnant workers are temporarily exempt, but they will need to, if they think they're going to be permanently exempt, which is probably unlikely, then they can apply for, but there are some circumstances where you could, pregnancy with an additional condition could make you medically exempt for a longer period. So I think they'd need to go through the formal process as well and see whether they can get that. But otherwise, it will, I'm trying to think now, I think the guidance said that the exemption expires a certain period after they've had the baby. I can't remember exactly, even if you go through the formal process, I think that's the default position. And I think it was 8 weeks or 12 weeks. I can double check that. But for some people, it will probably depend on when they go on maternity leave, because if they're going on maternity leave around Christmas time, then you probably come to an agreement where if their exemption is lapsing, they would just either take, if they want to take maternity leave early, or they could take some holiday, and then they could wait until they've had their baby and then just get vaccinated after that before they return to work. So that that you wouldn't want to be kind of insisting that they have it when actually they're not going to be, they're just about to go off for a year. Thank you. And then another one that's come up quite a lot is if the booster jab's going to be included in the regulations. Yeah,
it's not currently in the regulations. Whether they will amend them to include that, I mean, it's possible. It'd be very easy to do. I suppose it might depend on what the data shows around uptake. So if the capacity tracker data says that the uptake on the boosters is low, then you can envisage that becoming a regulatory requirement. Yeah.
Thank you. And just the last one is, what sort of evidence will we need to see for healthcare professionals and contractors after the 11th of November that they've been double vaxxed?
So it's the same as for staff. So you'll need to see the NHS COVID pass. Obviously they may well be exempt. Interestingly, the exemption guidance makes no reference at all to third parties, but the formal exemption process is kind of open to everyone in society. So those third parties could apply for an exemption. But I think what a lot of third-party organisations will do is, if they've got some staff who are exempt, from their own risk management perspectives, they will probably shift their staff around internally, so that though, you know, it depends on the organisation, doesn't it? But you know, so that those who are exempt aren't the ones going into the care homes, because there's a potentially increased risk there.
Thank you.
Brilliant, thank you, Hayley and James. James, actually, I've got one quick question myself. You mentioned a figure of an estimate of 40 to 50,000, I think, people who might
70, yeah, 40 to 70.
40 to 70, wow, okay. Do you know what that is like in terms of a percentage? How many people are working in the sector in total? Do you have a percentage?
I think there are 1.5. Well, I know that because that's the entire sector, isn't it? I'm not sure what of the 1.5 million in social care. I'm not sure what percent, you know, what element of that is just care homes, because at the moment we're just talking about care homes. So I'm not sure from a
sort of 5-ish% of the 1.5 million, but obviously it could be therefore 10% of care home staff, couldn't it? Easily?
Yeah.
Okay. Fascinating and worrying as well. But thank you very much for that and that useful advice. So we are now moving to our next speaker, who is Lee Stribling from the Care Workers Charity. Are you there, Lee?
Just appearing.
Perfect, well done, thank you.
Good morning, everybody. Really nice to see so many people on the call today. And I thought I would do the kind of thing that I normally do for similar sessions to this, is just to raise a bit of awareness of who we are at the Care Workers Charity and what we do. So I'm Lee Stribling. I'm the operations manager at the Care Workers Charity. We're the only charity in the UK specifically for care workers and people who work in social care. And to give you a bit of an insight into what we do, I'm just going to share with you a few sort of case studies of people that we've helped. The first was a care worker, and they were being financially abused by a relative in their home, and they'd had numerous loans taken out in their name. Obviously, when that came to light, when the money started coming out for those loans, they realised that they were being financially abused. They wanted to leave the home, wanted to live somewhere else, but they couldn't afford to leave. And not only that, even if they left, they'd be taking the liability for those loans back with them to wherever they went. Secondly, it was a registered manager who, when I spoke to her, she broke down and cried. She said she couldn't sleep, she couldn't function. She was suffering from bereavement at the death of some of her staff in the early days who contracted COVID-19 and feeling dreadfully responsible. She was burnt out, trying to support her team, but she told me she just felt empty and that she'd got absolutely nothing left to give. And she was also petrified that at some point she'd be taking COVID home to her family, which included an elderly relative. Another person was a support worker who'd lost 50% of their income because of the restricted movement between establishments, and they contracted COVID and they had to isolate. And then finally, a care worker who was being physically abused by their partner, and they were absolutely desperate to escape and set up a new home, but had no money for a deposit, no money for a bed for their child, and no money for any other furnishings. Those are the kind of cases that we see every single day at the Care Workers Charity. And we are currently in a fortunate position where we can support people in those sorts of circumstances. We try to support as many people as we can, and we do that in the form of financial grants. So people get sent, they apply for a grant, and we get the evidence from them on what they're telling us. We talk to their manager to verify that they are working in the sector, and we provide them with a financial grant in those circumstances. But we also, because we like to do a holistic review of everybody who comes to us, a lot of those people that I've mentioned earlier would really benefit from some mental health and wellbeing support, and we're able to offer that to them too. So we have a range of grants which are open to anybody working in private organisations within social care. We're called the Care Workers Charity, but we also get lots of applications from domestic staff, from activities coordinators, all of those people. And just because we're called the Care Workers Charity doesn't mean that those are the only people that we support. So in essence, we have two main financial grants. The first one, which is very relevant at the moment, is the COVID-19 grant. So that is for people who are currently working in the sector, and it's for people who've had to isolate, or they've had COVID, maybe then got long COVID afterwards. We get quite a few where people had COVID, then they went into hospital, they've come out, they're still not well enough to go to work. They're only getting SSP now, and obviously they've got bills to pay. Staff who lost work because of restrictions on movement between care homes, and that's been they've seen an income in there, a drop in their income. Or care workers responsible for paying the funeral costs of next of kin, or, and we're seeing quite a few of these, paying funeral grants for a care worker who's died from COVID, and we pay those to the next of kin. Also, where staff have incurred additional childcare costs. So maybe mum and dad or somebody else in the family has looked after their children before, because they're now scared of getting COVID. And, you know, there's all sorts of stuff on the news about what's happening in schools. So for those people who are now looking for childminders or wraparound after school care, we can help with additional childcare costs. So basically anything to do with COVID-19 is covered by the COVID-19 grants. So as a rule of thumb, people can apply for one COVID-19 and one of the next grants I'm going to talk to you about, the crisis grants, within any financial year. And quite often, because we want to give people as much money as we can based on their different circumstances, we might suggest that they apply for a COVID grant if they've had to isolate, and then they might have other circumstances not relating to COVID, which would meet the crisis grants eligibility, so they can apply for both. So people can apply for one of each of those within any 12 months. We're now starting to see lots of people coming to us who had a grant last year and need more help again this year. And I'm going to touch on that in a second, because the second grant that we have is our crisis grants. And these are open to people who are working in social care now, or they've worked in social care for at least 5 years in their working lives. So we're seeing people come to us now who are in their 70s, who worked in social care for 5, 6, 10, 20 years in the past. They've now got some unforeseen or life-changing circumstances, and they need a bit of a helping hand. So these crisis grants are one-off payments to support someone in those circumstances. And it could be bereavement, loss of a partner, illness or injury, funeral expenses, or having to move home, or maybe where they're having to travel to hospital quite a lot. So I was talking to somebody the other day whose child has to go to Great Ormond Street regularly. They live in Nottingham, it's very costly. They need help with hospital expenses, and sometimes for home repairs as well. So the crisis grant would cover kind of all of those situations. And it's quite a technical grant to administer, whereas the COVID-19 grant is very quick and we can process those very quickly. The crisis grants, we need to look at people's circumstances. Who else is living in the home? What income is coming into the home from other people? So it's a little bit more complicated, and they take a little bit longer to do. And those grants can also be used for things like daily living expenses or essential white goods such as washing machines. And what we're getting a lot of is people facing eviction. And this is becoming a really big thing. We've had 3 quite technical cases this week alone of people who've got to the point where the bailiffs are going to be knocking on their door within the next few days. So they've been not being able to pay their rent for many months. They've kind of parked it to the side and hoped it would go away, but it doesn't go away, and there comes a point where they face reality and they know they're going to lose their homes. So we've got quite a few of those that we're dealing with at the moment, and they are becoming something that we're seeing more and more of, you know, every week. And it is a bit of a concern to me that if we've helped those people in the past and they've come back a year later and they're still in that same situation, we need to see if we can find them some other support elsewhere to help them manage their money, because we can't keep funding people for that every year. So those are the two financial grants. The size of the grant is, it really, what we award people depends on individual circumstances. So as a rule of thumb, for a COVID-19 grant, if somebody works full-time, so they're working 16 hours a week or more, if they've been off for 2 weeks, we'll award £500. For every day less than 2 weeks, we deduct £35. For a part-time worker, 2 weeks would be £300, and we deduct £17.50 per day for every day less than that. So, and for some people, we'll pay out a lot more. It depends on what their individual circumstances are. The team fight really hard to award people as much funding as they can. And quite often we have to make a special case. So we have in our heads a maximum funding level of £2,000, which is COVID related, and those are exceptions. But sometimes cases come to us where we feel we really want to award them more. So we have to make a case. That case goes to our CEO. So we present the case to them, give them all the evidence. If they agree, we can provide a bit more funding. Sometimes the cases have to go to the board because people have come to us. They don't really meet the criteria, but we feel very strongly that we want to give them some money where we possibly can. So in those circumstances, we would pay a little bit more. The other thing to say about the grants is they're called grants, but people don't pay them back. We don't expect people to repay a grant to us. If they want to repay something, we would ask them to do some fundraising on our behalf, because that's where we get all of our income from. It comes from trusts and foundations, from partners, and other people in the sector who want to help, and individuals who, we had a walk along Hadrian's Wall a couple of weeks ago, which we had lots of people taking part in that to raise funds. We have individuals who, instead of having money for their birthdays, they ask people to donate to the charity. So we really rely on that kind of income from people. So those grants don't need to be paid back. And the next one that we have isn't a financial grant. It's called our mental wellbeing and health support. And we set it up because we knew from lots of care workers contacting us that their mental health was really struggling. A lot of people with PTSD, people who were not sleeping or not eating or overeating or drinking, all of those sort of issues because of things that were happening at work or in their home lives. So we started looking at ways that we could support them. And they were telling us that they quite often would go to their GP, and in the first instance, the GP would say, yes, you definitely would benefit from some counselling, but unfortunately, there is a waiting list. And I know in some areas, the waiting list is 2 years now. So we started to offer that as something we could do to support people. We can offer up to 10 sessions of therapy with an accredited therapist. And if people need more, then we can offer them more. And the feedback has been incredible that, we've had lots of care workers and registered managers who've been off work for a long time because of mental health issues, saying they now feel ready to go back to work. So we know that's been sort of very beneficial to them. So the other thing I would say is there is information available to you about all of the work that we do and the grants that we have. I always say to managers, please don't wait until your staff come to you and say, I've got a problem, I've got an issue. We're all very pragmatic working in social care, and we're also quite proud. And we don't always want to admit to our colleagues that we're struggling a bit, we need a bit of a helping hand, or that we're suffering from domestic abuse or whatever the situation may be. If your staff are given all of the information at the beginning, then if they need it, they'll know where to find that information and they'll know how to get in touch with us. And once they get in touch with us, we can help them. One of the questions is that, can a carer apply for all 3 grants if their circumstances warrant it? Yes, of course they can. And the other thing to mention is that with the mental health and wellbeing, we don't even need to contact employers if the person who's applying for the grant self-refers, and they can provide evidence that they're working in the sector. Because again, sometimes we don't want to go to our manager and say, do you know what, I'm really struggling with this. And if they can do that, and if they can do that confidentially, then, you know, we've noticed it's meant more people coming to us for our support. So that's really all I wanted to say. And I just wondered if anybody had any other questions.
That's really positive to hear of the support that you've got going there, Lee. We all know of people in the sector who would benefit from support in that sort of way, I'm sure. So that's really nice to see. For the contact details, I've had a quick look at the website, which is very easy to find. Is there any kind of literature or anything that we can post?
Funny you should say that. We have got we've got some literature with hyperlinks to everything on, and it goes into a lot more detail than I went into today. So I'm really happy to email that, and if it can go out to everybody, the more we spread the word, really, the better. We'd be really pleased to do that. And I've noticed from some other similar sessions to this, it's meant a surge in applications from that specific area. And for me, that's really rewarding, because it means we're spreading the word.
Brilliant. Well, thank you for the good work. Our next speaker is actually speaking about loan sharks and how to stop people ending up using their sort of services. So obviously very closely related to what you've been saying. I'm not sure who the actual speaker is, though. It doesn't say on my program. Hayley, about
we've got Graham and Bryony who have come to speak to us.
Brilliant. Okay, well, so thank you very much to Lee, and hello to Graham and Bryony.
Hi there.
Hi.
Hello, good morning. We have a presentation, but I'm not sure if I'm able to share my screen. Shall I try?
You should be able to. I've enabled sharing.
Okay, perfect. Thank you. I have emailed it to you as well, Hayley, but let's try this. Okay, is that working?
Yeah, thank you.
Perfect. Okay, thank you very much, everybody. Good morning. So my name's Bryony McDonald. I am a liaison officer for the England Illegal Money Lending team, and I'm here with Graham from Boom Credit Union, and we're just going to give you a quick presentation this morning about loan sharks, about our team, and about the joint work that we do with Boom Credit Union. I just want to say I'm not your local liaison officer. That's my colleague Lynn, but she's unfortunately wasn't available this morning. So I'm just stepping in, and I'm going to give a very brief overview. But if anybody wants a more in-depth training session, then that is absolutely available through Lynn, and everything is free of charge. So if you want more from us, then you can definitely have it.
Sorry, just burst in. We're holding a specific hour-long session with Lynn next week, so I'll just pop the link in the chat.
Perfect, that's great, thank you. Yeah, so this will be a bit of a whistle-stop tour, but you'll get a lot more from Lynn. The England Illegal Money Lending team, as it says, is a team that covers all of England. There is a separate team for Wales, Scotland and Northern Ireland, so we just cover England. We are a trading standards team that started in 2004, and we're hosted by Birmingham City Council. So you will notice that if you email any of us, you'll see that our email address is birmingham.gov.uk. That just is basically who employs us. So as a team, we are spread out across the whole of England. There will be people based in the areas in which they are working. So for example, I'm east of England, I'm based in Cambridgeshire. Lynn is the southeast of England, and I believe she's based down near Brighton way. We're always able to get out and see potential victims. Hopefully it shouldn't take us too long, but may depend on traffic, and especially for me, the M25. So before the team started, there had been no loan shark prosecuted for over 20 years. So although it has been illegal, and it was illegal, unfortunately no one was really doing anything about it. And as a result, loan sharks were kind of just out there doing their own thing, getting away with it. And there was an awful lot of them. So our team was set up. We are a dedicated specialist team. So although we are a trading standards team, we don't get involved in any other aspects of trading standards. We are purely there to look at the illegal money lenders or loan sharks, which are one and the same thing. So we have a couple of teams within our team. We have 2 teams of investigators, and their role is very much around the prosecution side of things. So they mostly come from a police or a trading standards background, and their remit is around gathering evidence, taking statements, going out, doing warrants, you know, making arrests, and taking that all the way through to hopefully a prosecution at court. We then have a team of liaise officers. So that is where myself and Lynn come in. So we have 16 liaise officers for England, which is not very many when you consider how many people are in England. So there's just 16 of us. So first and foremost, our remit as a liaise officer is to provide victim support. So we are there to support those people that have been affected by loan sharks, be that the person that has borrowed or the family of the person that's borrowed, or even the community of the people that have been affected by loan sharks. And that support will look very different depending on case by case. So you might have some victims that are kind of like, I just want you to get this person out of my life, and then I'm absolutely fine, I've got everything else completely handled. And then on the other case, you might have a victim that needs us to be in contact with them 2 or 3 times a week. They might need a full, I mean, we do a full risk assessment and needs assessment with everybody that we're working with, anybody, but they might have a lot of actions on that. They might need us to help them with housing, for example. They might need us to get involved in any child protection or child in need matters. They might need us to make some onward referrals to other specialist help agencies. So that is very much what we are there for. In terms of the victim support, it's a holistic approach, and it is as much support as that victim needs from us for as long as they need it for. So in that respect, we are very, very lucky. The other part of our role is very much around raising awareness. So we know for a fact that the number one reason that people don't report loan sharks is because they're scared of them. But the second reason is because they don't know enough about loan sharks. They don't understand what loan sharks are, and they don't know who they're supposed to report that to. Unfortunately, a lot of people do believe that the loan shark that they've borrowed from is actually just a friend. They don't think that anything illegal has happened, and quite frequently we do find that they are advised from other agencies that it's a civil matter, it's just a loan between 2 friends, and it's something that would need to be dealt with at civil courts. So it's really important that we offer this free training to people who are on the front line, who are working with people who may be potentially vulnerable to using loan sharks or may have already used loan sharks, so that we can upskill as many people to almost be our eyes and our ears for us. With 16 of us, there's no way in the world that we're ever going to get in front of every potentially vulnerable person, unfortunately, and we need to put our resources where they are needed. So that is why we offer all of the free training and awareness raising to other professionals who are working day to day with potentially vulnerable people, so that we kind of ask you to be our eyes and our ears. Just let us know if you are aware of any activity, if you know of any victims, because then we can put the right resource where it needs to be. So I guess the question is, what is a loan shark? What are we looking out for? So when we're talking about loan sharks, we are talking about people that do not have a license from the Financial Conduct Authority, essentially. There's often myths about what loan sharks are. They're people that go around with baseball bats and beat people up and break their legs and threaten to do X, Y, and Z, or they're people that are charging really, really extortionate interest rates. But that's not necessarily the case. We see a lot of cases where the interest rates aren't humongously high, not in comparison to some others. We have a lot of cases where there has been no violence, no threats made. It's more a manipulation of the victim than it is an actual outright threat of violence, for example. So when we're talking about loan sharks, what we are talking about is people that do not have a license from the Financial Conduct Authority, yet they are running an unauthorised business. So the definition of a loan shark, as you can see there, is an individual running an unauthorised business under the Financial Services and Markets Act of 2000. What that means is, when we say business, they're lending to at least 2 people and they're charging some form of interest. So you can imagine if you are talking to any of your clients, anybody that you might be working with, and they might say to you, oh, I borrowed money from a friend last week and I absolutely need to prioritise paying them back. That's kind of something that you might hear quite frequently. And actually that's something that we hear a lot. And it turns out that that isn't a friend, and it's a loan shark. But that person has come across as a friend, a helpful acquaintance, somebody in their community that's doing them a favour, lending them money when, you know, they really need that quick cash injection, but they can't necessarily go to their bank, for example, or, you know, because they're just not going to be awarded that. So when we're talking about loan sharks, it's people that are lending without a licence from the FCA. They're lending to at least 2 people and they are charging some form of interest. And if those 3 things are happening, then that is something that we as a team want to be told about, and we will start an investigation and we would be looking to carry out a prosecution. So to date, we've now had over 400 prosecutions. We have helped over 31,500 people who have been affected by loan sharks. It's believed that there's somewhere in the region of 310,000 households that use a loan shark at any one time. So it is widespread, it is happening in every community. And unfortunately, we are, you know, we're only scratching the surface a little bit in terms of who we have already helped. So we really need to get that message out there about our team and about what loan sharks are. We have wiped out over £85.5 million of illegal debt. So that's quite a massive thing for the people that we're working with, because they all believed that they were going to have to continue to make payments to these people. And it was often huge amounts of their income. You know, we're talking about maybe 90 to 95% of their weekly or their monthly income was going over to these loan sharks, and it was leaving them with absolutely nothing to live on. So the fact that we're able to say, actually, this is an illegal loan, you can stop making those payments, we've risk assessed this situation, you don't need to continue to make any payments, we are investigating and we will support you through this process, is quite often life-changing for the people that we are working with. We've also had prison sentences totaling over 591 years now for illegal money lending and associated crimes. And those lists of crimes that are associated with the convictions are things like we've had firearms offences, we've had drug offences, we've had a rape conviction, we've had kidnap, we've had assaults. So all of that stuff is sometimes going hand in hand with the loan sharking behaviour. So you can see the sort of situation that our victims might be finding themselves in, unfortunately. How do you contact us? So you will have Lynn's direct contact details. You can also take my direct contact details. That's absolutely fine if you want to share those as well. As I said, I'm for the east of England, but me and Lynn quite often kind of swap and cover for each other. We also have a 24-hour helpline. So this is available every day. And it will be answered by either one of the liaise team or an investigator. So it's someone within our team. It's not a call centre or anything like that. Calls can be anonymous. Everything is completely confidential. We don't record or anything like that. Obviously, we would ideally want victims to be engaging with us and telling us who they are, but we know that sometimes that is going to be a barrier to them reporting. So things can be absolutely kept anonymous if that's what they want, or if a third party like yourself has got the information, but you're not really sure that you know about reporting that, then that can be anonymous as well. We also have an app. That is the QR code for the app if you want to download it, which is aimed at professionals. So it's a really, really good little app. We have a web chat available on our website, which is Monday to Friday 9 to 5, which again is anonymous and completely confidential, and loads of tools available on our website as well. So I'll just round off before I hand over to Graham. So in terms of what we offer to partners, obviously we are asking a lot of you to kind of be our eyes and our ears on the ground. We do offer a full training. So as I said, Lynn will be available to offer a full training on exactly what to look out for, how to make those reports, the victim journey training. We also offer a credit union training session as well, and all of that is free of charge. We can tailor it to whatever your organisation needs it to be. It can be face-to-face or it can be online as well. We obviously want to support clients. We want to remove the loan shark. Everything that we offer is free of charge. So we have publicity materials, posters, leaflets, you name it. We have some giant shark suits. So if anyone has a burning desire to dress up as a giant shark, then we are the team for you to speak to. We can give you social media content. We can give you stuff for your websites. We've got, you know, all sorts of different things, education packs, newsletters, you name it. One of the other things that we do is we get some money back from proceeds of crime, and we try and work with partner agencies, in particular with credit unions, because we see them as a very good alternative for people that might be going to use a loan shark, and we want to try and encourage them to engage with their local credit union instead. So we offer a proceeds of crime fund every year, and we also offer some credit union incentives, savings incentive schemes as well. So that is where I will hand over to Graham to carry on, and I'll press the buttons whenever you tell me, Graham.
Brilliant. Thanks very much, Bryony. Yeah, thanks everyone for having us along today. This is just a really quick overview about what Boom Credit Union is, and hopefully it will be clear how kind of our services, as Bryony said, could support the illegal money lending team's work, and help prevent some people from turning to the illegal lenders. So Boom is a not-for-profit financial cooperative, and how that works is our members are shareholders, so everybody owns a bit of the organisation. Everybody is encouraged to get involved. For example, there's an annual general meeting to vote on key business decisions, etc. It's free to join Boom, and all of our members save, even those who take out a loan. And it's those savings that are pulled together and then are able to fund affordable loans to those that need them. So Boom is, if you like, a financial community of local people that support each other and together build financial resilience across the community. Our main office is in Worthing, and at the moment, most of our business is online. You can access all of our products and services on our website. We're in the process of moving office, still based in Worthing, but this will provide us a bit more space and better facilities for visitors. So we will have a dedicated reception area, and we intend as soon as we can to open up, and are very keen to keep our roots on the high street in the community so people can access us through the door as well. Thanks, Bryony. So our products, so of course we do loans, but we have configured and developed some of these specifically for certain groups of people. So we've got general personal loans. We give discounts for people in key worker professions. We provide family loans for families with children, and they can make their loan repayments direct from child benefit. And that's a really popular option. It seems to be quite an easier way for families to manage the ins and outs of money. And of course, they're saving at the same time, so they can put away part of that child benefit into a separate savings account too. So that is really popular. We provide a lot of debt consolidation. So we can often improve somebody's disposable income by wrapping up multiple credit cards, overdrafts, high interest loans into one loan repayment. We provide current accounts through Engage, and these are for people that have struggled to get a bank account, for example, from the high street, and these accounts come hand in hand with a credit union savings account, but also provide them with a contactless Visa debit card, direct debits. You get an account number and a sort code, so it gives them the full functionality of an everyday bank account as well. We encourage everyone to save, and one way we do that is by providing workplace saving schemes and this helps people put money aside each time they're paid. And we encourage youngsters to save as well. So we have a junior savers account, and we run a number of school savings clubs too. So the difference between Boom and a bank, a key difference is that we operate within a common bond. And we feel this is a real plus for the areas we operate. So to be part of Boom, you have to live or work within certain areas. They are listed to the right there. So East Hampshire, Kingston, Surrey, Portsmouth, and West Sussex. So that's a really attractive kind of thing to know for people that, particularly people that save and deposit money in the credit union but don't take out a loan, because they know that their savings are kept local for it to support other people close by who perhaps want to access a loan. So we often have people choosing us over a bank account to keep their savings. So as Bryony said, the illegal money lending team partner with organisations like Boom, really just to get the message out there and raise awareness of loan sharks, and we take that opportunity to do that as well. So we have had access to the Proceeds of Crime Act funding, and with that we've provided savings incentives. We've delivered radio campaigns across West Sussex on More Radio, and social media campaigns as well. We're about to launch another one from next month through to January, trying to highlight the dangers of loan sharks at a critical time leading up to Christmas and afterwards. And that will be done with Greatest Hits Radio this time. So as well as loan sharks, we try to prevent people going to high interest lenders. Now, these are regulated and legal lenders, but there are still many, particularly online, that charge eye-watering interest rates. And there's just a few you can find with a quick Google for if you're searching for a loan for poor credit, for example, or bad credit history but need a loan. These are the kind of companies that you will come across. Thousands of % APR in some cases. Now, Boom lends to a similar, if not the same, demographic. So you can see by comparison that our interest rates are a fraction of those. And then, of course, we have a future-focused approach in terms of the savings element as well. Now, for anyone that can access a bank loan, if anyone can at the moment, the rates will be, of course, a lot lower than Boom's, and we would always encourage anybody to shop around and look for the best rates. But when your choices become more limited, you can see that there are options out there that are best probably avoided. And we expect demand for loans to go up now. Of course, everybody is experiencing squeezed income. Those on universal credit have had the £20 uplift removed. You've got the energy prices going through the roof. Fuel prices for anyone driving to work, driving the kids to school. Everything seems to be putting a squeeze on incomes. So in one respect, we expect to see demand for our loans, particularly smaller loans. We lend from £300. We expect demand for that to go up. But also we're prepared for our current customer base that have loans. We expect to receive a little bit more contact from them if they're struggling to meet repayments. And we have a team dedicated in our office to support those people. And we've just brought on a full-time member of staff to make sure that we're prepared to handle any extra contact on that front. So on our personal loans, so we set out to help people avoid the ridiculous and unfairly high interest rates. You don't have to be employed to get a boom loan. It's all about affordability. So we assess the income, and that income can be from benefits or a pension, a child benefit, for example. We assess bank statements, etc., to make sure that our payments are affordable. As I said, if we're consolidating existing debts, we can very often reduce the outgoing payment and just make life a little bit more comfortable for our members by improving their disposable income and keeping a little bit more money in their pockets. As I said, we reduce our rates for key workers and British Armed Forces and veterans. And a big plus for anyone that borrows from Boom is, and they tend to forget about this part actually, when we set up a loan repayment plan, it's one repayment, but when that payment comes in, we split it 2 ways. So part of the payment goes to repay the loan, and some of it goes into a separate savings account, which is locked away until the loan's repaid. As I say, many members forget about that, and they get a nice surprise when the loan is repaid. Sometimes for the larger loans, which can be repaid over 5 years, that pot of savings can become quite substantial in the thousands of pounds. So it's a really positive way to end the loan and break the cycle.
And Graham, just to let you know, we're just coming to the end of your slot, but I'm more than happy to share all your slides as well.
Okay, thanks. So I will wrap it up by just saying it's not all about loans with Boom. You can just open a savings account, and that is part of the business we're always aiming to grow. And that's just because the savings, as I said, fund the loans. And as more savings come in, we can provide more loans to local people. So we're often going out there, encouraging people to join us, even if they don't need a loan. You know, anybody can join Boom to put some savings aside. If there's any questions now, happy to take them. But of course, anybody can contact us directly.
That's really, really helpful stuff. Again, I think that those three different talks on related subjects just are coming at the right time. As you were saying there, it's quite clear that lots of people are going to have extra financial pressures now, Graham, aren't they? I think so. All these different angles are of great value, really. One thing that I was going to ask, if somebody is saving with you, are their savings protected?
Yes, indeed. So just like a bank, it's FSCS protected. So the savings deposits are completely safe. If the worst were to happen to Boom, and you may have seen in the news, some credit unions of late have, disappeared, if you like, but savings are paid back to members within days. But I'm pleased to say Boom is in a very secure position.
Be a good headline if you did go bust, though, wouldn't it?
A bit of an obvious one. Let's hope not.
Yeah. Okay. Well, but again, I mean, on a serious note, hopefully that we can all be sharing all this information with our colleagues, and it can just keep people away from the loan sharks, which is really important. So thank you very much. Were there any other questions? Okay, so moving on, I think it's probably Nada speaking from the WSPiC team.
Oh, good morning.
Hi, Nada.
Hello.
Do you want to do your slides, or do you want me to show your slides?
Yes, I'll try and share my slides and see what happens.
Looks good.
So hopefully you can all see all that, yeah?
Yeah.
Okay. Well, good morning, and thank you all for your time today. I'm going to talk about something entirely different. WSPiC, I'm sure you've heard about it before. My name is Nada Wakeford, and my role is to support care providers to complete their toolkit. But what I'm going to do today is try and put it in a wider context of integrated care systems and integrated care records, which will explain why I've entitled this presentation as Your Gateway to the Future, and why there is so much emphasis on completing the toolkit all of a sudden. As the saying goes, that all roads need to Rome, when it comes to me at the moment, all roads lead to WSPiC. So let's go on to the next slide. I'll tell you a little bit about the integrated care system. So they were all set out, NHS England set it out in the NHS long-term plan. Integrated care systems are basically new partnerships between organisations to meet health and care needs across an area and coordinated services in a way that improves population health and reduces inequality. So basically they bring together providers and commissioners of NHS services with local authorities and other partners, with the central aim of integrating care across different organisations. Now, for us who have been in social care for a while, we know that hasn't really been happening lately. But what they're hoping to achieve is to join up hospital and community-based services, so mental and physical health and social care. Integrated care services are intended to bring about major changes in a way that health and social care are funded, delivered and paid for. And again, for those of us who have been in adult social care for a while, we know this is something that's been talked about quite a lot. But judging by the political will and the funding that's been put into the system, it looks like it just may be happening this time. Which leads us to integrated care records. So if we narrow down integrated care systems, and one part of it is integrated care records. And all that is a system which interfaces with different digital health and social care records, which allow them to talk to each other and exchange secure information. Secure information is the key here, and this is where your WSPiC come in, but we'll get to that a little bit later. So during the pandemic, both health and social care providers were using data and digital technology, and they played a vital part into helping us manage the pandemic. But another thing that we found out is that the digital maturity and data quality varied an awful lot. And a lot of the time information was held in silos, which made it quite difficult for either health or social care professionals to access that data at the same time. So to address this, there is a program for digitalizing care records. And this is very significant really for all of you, because this program is aiming for all CQC registered adult social care providers to have access to digital social care record that can incorporate with local shared record by 2024. Quite ambitious program, whether it happens or not by 2024, I don't know. But it will definitely play a very important part in joining up care records across the NHS and care services. There will also be a platform on which other remote services can integrate, such as, so some of you may have used Dockerbo in the past, that was trialled a couple of years ago in Sussex, and I believe they're trialling it at the moment in Kent. And there are about 300,000 people who are using monitoring technology, such as monitoring their blood oxygen levels. Now, I don't need to tell you in how many ways health and social care are connected. So, for example, somebody is discharged from hospital into social care, and I don't need to tell you how difficult it is to access the right information at the right time. So this lack of integration is not only frustrating because it frustrates our communication, but it also can be quite dangerous. So digitalizing care records and making them capable of talking to each other will not only improve the communication, it will make care safer, and it will make access to information a lot easier. There is national support for providers to achieve that, and that is why we have something called digital social care. If you haven't seen it, do look on the website. They will give providers guidance and support materials, and recently they launched accredited supplier list. So if you are thinking about digitalizing your care records, or you are thinking about changing your care records provider, have a look at this accredited supplier list. It gives basically, there's at the moment only 4 providers who are on the list, but that is likely to change. They're also running masterclasses in various areas of digitalization, and the next masterclass is on the 26th of October. There will be a link for that masterclass. Now, we all know that nothing happens much in life unless we have political will and funding that supports it, but our current Health Secretary, Sajid Javid, as well as the one before him, whose name we don't want to mention, they seem to be very keen and interested in digitalizing social care. So Sajid Javid is talking about the truly integrated systems for health and social care being a must, and he's talking about a long-awaited digital revolution. One of the reasons he's saying that is because 1 in 10 NHS trusts still operate on largely paper-based systems, and apparently 71% of social care has no digital access on information on medications of people in their care. Now, I'm not sure whether he means by this access to surgery medication records or our own EMA systems, but I'm not sure what he has in mind. But the way of addressing it, Javid is talking about shoring up cybersecurity and cyber capability, also about updating an out-of-date system and adopting the shared records. So it is estimated that in hospital, shared record can reduce the time to access a record from 15 minutes to 30 seconds. Now, I don't know where they got the 15 minutes from. If any of you try to get any records from hospital, it usually takes about 3 days, but we're not going to go into that right now. It is also estimated that in the care homes, it would save about 10 hours of care worker time per care home per week. And I'm not sure about this either, but that's what we are told. But for all of this to happen, the first step for you to take in this is DSPT. And this is what I'm saying. It is your gateway for the future. So what is this toolkit? It is an online self-assessment of your organization's data security and cybersecurity arrangement that you may have in your organization. It consists of 44 questions, which are divided into 4 categories, and you can reach 3 standards. But we really only need to concentrate on standards met. For me, when I was completing the toolkit, it was great because it gives advice and it's a checklist of good practice, and it demonstrates compliance with data protection legislation. So central government bodies, your local authorities, CCG commissioners, Care Quality Commission, National Data Guardian, they all recognize the toolkit as an official way to evaluate your compliance with legal requirements. So so even if you are thinking, now listening to this, all your presentations, we have a lot of things to deal with, such as pandemic and staff shortages, staff retention, terrible state social care is in. You may be thinking, well, why on earth do I want to do toolkit right now? I've got better things to do. But it's not actually that difficult to do. So most of the providers who have attended our workshops have felt that we have demystified it. They felt relieved. It was a lot simpler than they thought. I've put a quote here from one of the providers who completed the toolkit just as we went along. So he basically worked with us and completed it, and he thought it was really easy. We took all the stress out of it. And there's a good advice here from him is to have a piece of cake while you're completing your toolkit. So apart from being prepared for the future and apart from proving that you are compliant, completing the toolkit will also answer a couple of your queries on well-led and caring. It will give you access to some key NHS digital services, such as NHS Mail Proxy Access and Shared Record. It is a contractual requirement for CCGs and local authorities. Now, up to now, they haven't been really asking for evidence of this, but I'm led to believe that next time to renew your contract, questions will be asked about your DSPT status. I will concentrate a little bit on proxy access and NHS Mail. So during the pandemic, many of you have been given access to NHS Mail without completing the DSPT, so the requirement was waived. However, if now you want to complete the DSP, you want to have NHS Mail, you will have to complete DSPT to approaching standards. When it comes to proxy access, similar is the case. So many providers were given access, given proxy without completing the DSPT, but if you have proxy, you will have to complete your DSPT retrospectively. Proxy ordering is extremely beneficial to care providers. I've never met a single one who said, I shouldn't have bothered with proxy. They're all telling me I wouldn't be without it. So proxy ordering enables the care home to order medications, monthly medications, as well as interim and some acute prescriptions via Practice's online portal. And you have exactly the same access as a person would if they were accessing it from their own home. It also, implementing proxy is also the first step in gaining access to residents' records, medical records, for example, any test results, or you want patient summaries or hospital discharge letters, or you can book appointments, cancel appointments, etc. So very, very useful. It is when you're ordering your medications using proxy, there are definitely fewer errors and fewer queries. It is a much faster, more time-efficient process. And you know at all times where your prescriptions are and what is happening to them. So you can log in at any time of day or night. So you're not restricted to Monday to Friday, 9 to 5, apart from Wednesday afternoon when they're on training. You can actually know where your prescriptions are. You can train your night staff to do it. What I like about proxy ordering is a great audit trail, and it also saves a lot of time. So people who are responsible for proxy access, they've worked it out that before proxy, a care home and practice staff, it would take them about 3 days to process, repeat your monthly medications, whilst now it takes 1 hour and 4 minutes exactly. I'm not responsible for proxy access, but if any of you are interested in proxy, then do let me know. I'll put you in touch with the right people and they'll be delighted to help you. Also NHS Mail, I know some of you are having difficulties with NHS Mail. They're quite slow to respond. And when they do respond, a lot of the time you'll get an answer ticket closed, even though your query hasn't been resolved. So do let me know. Whilst I'm not dealing with NHS Mail or proxy, I can put you in contact with the right people who can help you. So what do you do now? Well, there's an easy way and there's a hard way of doing it. I'll give you the hard way first. You go online, you find your ODS code. I know this means nothing to most people. You register. You set up your profile, you complete your toolkit, and then you publish it, and that is then you're done. Or there's an easy way of doing it. You'll contact me or Brian or Debbie, who are also part of our team, or you'll book one of our free online events. Our next events are Crash Course in DSPT, when you can complete it in 1 day. It is on the 26th, 7th or 8th of October, and this is the link. So what we'll do, we'll find your ODS code for you. We'll guide you through the registration and through each question, and then you can just publish your toolkit and you're done for a year. I've put a link here for another event. It is a masterclass, as I mentioned earlier, from Digital Social Care. It is still on the 26th of October, but it doesn't clash with our event. If it did, I wouldn't have put it on it. So you can, these slides can be emailed to you so you can have access to these. There is a lot of help available. So there are a lot of resources on digital social care, and the toolkit itself gives you a lot of resources, guidance, templates, policies and advice. A lot of this information is available on both West Sussex Partners in Care and RCA website if you want to look at them. And by all means, you can contact real people. That's Debbie, Brian and me. You can phone us, but the best way of contacting us is by emailing us, and our email addresses are here. So anything, any help, any support with DSPT, we're here for you. So the best way to contacting us is emailing us, and anything else to do with proxy or NHS mail, let me know and I'll put you in contact with the right people. And that is my whistleblow stop through the SPT, your road to the future. Any questions? I'm happy to answer.
Brilliant. Thank you, Nada. Just waiting to hear if anybody is coming forward with questions. And just to really, in a nutshell, back up everything that Nada's saying. Number one, it is an important and useful process to have completed for a whole variety of different reasons. And number two, it is actually very easy with just the guidance from the DSPT team. It really doesn't take that long at all, and it's a good job to have got done, and just one less monkey to have on your back giving you grief from other areas. So if you haven't got it done already, then strongly recommend taking up one of those crash course sessions.
Thank you.
If there are no questions, we'll move straight on to the next speaker, which on my list is Isaac, giving us some top tips for productivity.
Hello, good morning, everyone. Can you all hear me well?
Yeah, we can hear you loud and clear, Isaac.
Do I need to speak about DSPT? The slides are still up.
Yeah, I was going to say, Nada, can you take your slides down?
Sorry, I thought I stopped sharing.
Nice slides anyway, Nada. Yes, your designing skills are very good. So, very good morning to all. Have I got 20 minutes? Am I right? Or
you have got 15 minutes, and we are 5 minutes behind. So
okay. So in that case, you'll all have to work hard then. This is going to be a workshop.
We'll be extra productive.
Yeah, this is going to be a real workshop and action time. Okay, and I'm bored of talking about COVID and pandemic. You know, let's do something different, exciting. Very good morning. My name is Isaac, and can you all put in 2 sentences, two words, how you feel now? Just in the chat box. How do you feel now? You know, generally about social care, your own life. What do you feel? How is the day? Amazing day, or how is it going? Tired, deflated. Okay, you should have proper breakfast. Need a break, Vipin Francis. Yes, take a break after my session, Vipin. Fantastic. So, thank you very much. Yeah, I think I can see 34 people joining here, 33. So fantastic. So yeah, don't feel tired, don't feel overwhelmed. I'll give you some good tips today to take away with you and practice in your professional life. But there is more aspect to your life, like productivity, mindset, meditation, health, and we'll talk about it later. So today I want to discuss focus only on emails. How many of you have got zero inbox? Zero inbox. You know, how many of you got a zero inbox email inbox? Who is the proudest one? Zero inbox. Where's that one coming? I'm waiting. No? So just type down how many emails you have in your inbox now.
Oh.
Go for it, Rosemary. I'm curious about yours. Yes, 6. That's not bad. 6.
Really?
That's really cool. Yeah. Who is next? 763, Sophie. Yes, genuine, honest. Thank you, Sophie. 15 since 9:30, 2000. Fantastic. So let's, how about making that to 0 today? How do you feel about it? 9 across 3 different addresses. Yeah, how do you feel if we can make it to 0 now before the end of the workshop? Delete all, that could be an option. You'll be no, let's do it properly. Okay, let me share my screen with you. Google Chrome. Oh, I hope this works. I hope this works. Split screen. How do I do that? What can you see? Is it my presentation or my email inbox? What can you see? Or both?
We can
See
see
the presentation.
feelings about your inbox.
Both. You can see both the split screen, can't you?
Yeah.
Oh, fantastic, fantastic. Okay, if you could stop recording, that would be great, because this is my personal email. There's nothing.
I don't think-
Can't read it.
I think
You
if
can't
it's just
see your
me,
email.
I can only see your slides.
Ah, that's interesting. That's interesting. Okay, how do we deal with this? Okay, so we'll get back to this. Or I should actually, sorry, I thought this is going to work and it didn't work. So let's make it work. Share new screen. You must be able to see my desktop now.
Your slides.
That's fine, Tom. I can demo the slides. I'm sure I've
Okay.
got access. Let me just check. So we slideshow from current. Should be showing you some slides now.
Yeah.
Thank you. I'm not. I have put in the slideshow lots of information that's coming out later. So I've tended to focus on recruitment, workforce development fund to help you with your developments and training, and aspects of well-being and supporting staff. So that's in the slides for you to look at your leisure, but I really wanted to emphasize some local projects and provide some opportunity for Ruth to talk through what she's doing currently around CPD. So my main bit is around, we're going to be hearing about the Wellbeing for Managers project later from Juliet, I believe. So that'll be great to see. Ruth's going to give us a little bit of a conversation around CPD work she's doing, continued professional development for leaders and managers. So Ruth's going to have a chat with you, and then, you know, if you're willing to be interviewed, I'm sure she'll welcome that. I wanted to emphasize the last three ones really in the time I've got, which is along with Hayley, we've been organising some drop-in sessions around conversations about recruitment. And we have just used that opportunity to share ideas, anything that's coming through, any opportunities. And we've also started a WhatsApp group around that. So if you're interested in any of that, please do get in touch with me or Hayley. The next session, we thought we were still to confirm a date, but actually it's getting your best out of agencies, because having talked to a few good agency providers, they're saying stuff about how to really get the best out of agencies rather than be wagged by them, but actually be able to negotiate with them. So that was quite interesting. We'll try and get some input on that. And then nurses in social care, we've started a network across Sussex and Surrey. There's network meetings on a quarterly basis and a WhatsApp group for nurses in social care. So again, if you have nurses within your service and you think they would benefit from some peer support as well as CPD opportunities, because we do have our CCG links into that, then that could be something that you take up as well. And then the most current information is our integrated care system is called the Sussex Health and Care Partnership. And they've just agreed to a project focusing on the care at home workforce. It can feel quite neglected in terms of attention giving to the care at home workforce, because sometimes the NHS projects really focus on residential, and this project will focus on the care at home workforce, and inevitably it'll talk about recruitment, retention, careers and skills development. So if you want to be linked in to any of that, then I'd ask you to get in touch with me, and I'll remind you, I've put my email address in the chat. But I thought that could be an opportunity for us to have a much more of a pan-Sussex conversation about how can we support the care at home workforce in terms of a bit of time and attention. So those are the areas on the the local projects. And as I say, the rest of the slides that Hayley will share with you focuses on what are we doing nationally about recruitment, the Workforce Development Fund announcement and some aspects of wellbeing. I'll stop sharing so that we can just allow Ruth, if she's there, to, yep.
I am.
To take on a bit of a conversation about CPD. Over to you, Ruth.
Hello there. Hi, my name's Ruth Keynes, and I in fact used to work with Karen until last year at Skills for Care, and since then I've been working freelance, and actually wrote the bid, with the successful bid for the Wellbeing Project, which Juliet's going to be talking to you about. Also following on from the well-led project that was run by WSPiC around leadership and management that was finished just before the pandemic started. The whole area of leadership and management and CPD supporting people's skills in that area needs some attention. What I want to do is talk to you guys, and I do realise that you're incredibly busy, but if you could spare me some time so I can talk to you about what your CPD needs are, yours, not your staff, thinking about you. What are the critical issues that you're managing that some CPD would support, particularly around the areas of leadership and management. I'm happy to kind of grab any opportunities that I can to talk to people, to do one-to-one interviews, if you're happy to do that. Obviously, any information you share with me would be confidential, and there'll be no information about your particular care home, so you couldn't be identified. Or if we could do some small group discussions, which I'm sure Hayley could help facilitate. I'm more than happy to be able to do that. So we're very keen to hear what you feel are the priorities for this area. Do you know what's out there at the moment? There's a lot of stuff that's out there at the moment, from the Sussex Health and Care Partnership, for example, around coaching, supporting management, management skills, particularly with a focus on managing post-pandemic or the issues that have blown up during these last couple of years. Are you aware of them? Has anybody tried anything? And what have you thought about? Have you thought about it? What are your if you think that you what are your views on what would be the appropriate mode of delivery for provision? So as part of the project, I'm going to be talking to key stakeholders across the patch, the local authorities. I've already had conversations with the 2 universities and links with further education colleges, who are part, if you like, of the infrastructure of provision for CPD. So, as I say, I want to grab opportunities where I can. I will put, Karen's helpfully put my email address on the slides that will be circulated, but I'll also put my email address on the chat. So, and just encourage you to make contact. So I'm aware that we're struggling for time, but has anybody got any immediate comments about that?
Ruth, could I put it in a bit of context that we've been working with the University of Chichester to look at whether or not really the level 5 was fit for purpose to become a registered manager, and all the problems that have arisen during COVID, which is why we're looking at, hopefully my vision is an accreditation for Sussex registered managers, learning from all the well-led project and the outcomes of COVID, what would really have supported the managers to be able to manage in this unprecedented time. So I think it's a piece of work that hopefully will go on and benefit lots of managers in the future. So all I can say is please support Ruth in this really important piece of work that we will need to take forward to get funding from somewhere, to get it off the ground. But all I can say is these are lessons that we've learned, aren't they, really? None of us could have expected or prevented what was going to be happening. But I think if registered managers had had more tools in their toolbox, maybe, just maybe, they would have been able to survive a bit better, maybe. So I think it's looking forward positively and lessons learned.
Thanks, Rosamond. Just to add to what you've just said, I'm keen to talk to newly qualified managers, people who've been around for a long time, people who are nurse managers, because I think they may have a slightly different perspective as well. And yes, to reflect on your level 5 when you did it, and what you think the gaps were, and also hear about what CPD that you're currently accessing, and what you think about it, and how that could be improved. So I don't know if there are any comments, because we are tight for time, but just please don't hesitate, and you know, I'll try and. We'll make the interviews at a time that's convenient for you, if you're willing to be interviewed, and but I think hearing your perspective, we're very, very keen to hear what you think, and make sure that this informs what we put together out there to look towards developing a project that will support your needs. And without hearing what you think, it won't be as rich a product as a consequence. So as I say, I don't know if there are any thoughts at this stage.
Can I just say, Ruth, your bid writing is beyond reproach, and successfully we've got the development manager post out of it, and we've got the R&R project out of it. So I have 3 in a row is what we're trying to achieve, Ruth, isn't it?
Exactly.
But not another go, because I don't think I could stand it. But I just think you're beyond reproach, really, what we've achieved. Thank you to you, Ruth, primarily.
Good comment from Sue in the chat about experience that NVQ level 4, yes, that's what the award was. And
the original award.
Yeah, the original award, and actually not being expected to do any more is a good point, actually, Sue. It wasn't a professional expectation, or not expectation, probably right in a way, that, you know, here's a pathway that you could follow in terms of development. And what it might have been is what you've been able to cobble together as opportunities rather than a pathway. Thanks, Sue. It's a good comment. So, Ruth, I just wanted to reflect, of course, we're talking about development in its entirety. And of course, the thing I do pick up is the supervision opportunities as a development. And a lot of registered managers, of course, don't have that supervision opportunity. It might be with a proprietor who has expectations. It might not be clinical or professional supervision of any kind. So to think in that manner as well is part of this project, isn't it?
Oh, totally. Yes, totally. So yes, to think about CPD in the fullest sense of the word. It's not just about learning about a new piece of legislation and how it impacts on it, but to look at these broad skills, coaching, you know, listening, all of these things. And an interesting point about one of the things that really struck me in the interviews that I did for the recovery project with people is they were thinking about everybody but themselves. You know, their priorities were obviously their staff, their residents, their families, and one of the challenge, you know, and that they were right at the bottom of the priority list. And this is actually asking you to think about you and what your needs are and encouraging you to do that. So there's a couple of comments about, yeah, obviously the MBQ level 4. Level 5 doesn't even touch the sides in terms of the requirements to be a manager. I've heard that said on a number of occasions. So, you know, yeah, we want to hear what you've got to say.
And very quickly, we're just hoping this will be a seamless progression from everything that we're going to learn from the project that Juliet's doing and the well-led project, so we can see it as a pathway really to sustain the fragile sector at a time when we need it most, really.
Brilliant. Thank you, Rosemary, Ruth and Karen. And that will link onto the SCARF project, which is the Sussex Care Association's R&R framework. It's a great acronym, I like that one. But I think first we've just got a brief word from Emma at the CABS team, West Sussex County Council CABS team. Are you still there, Emma?
I am. Can you hear me, Tom?
Yeah, we're saving the best till last, Emma.
Oh, thank you. And I'll only be 2 minutes, I promise.
Excellent.
Just a couple of reminders. Just wanted to remind about next week's domiciliary care provider briefing, where we're going to be focusing around intent and in general around the tender process in general and any tips that we can share. And Karen Stevens is going to be attending to talk around retention and recruitment, which would be great. Also, just to say that our wider briefing will be back on the 28th of October. Just wanted to very quickly ask, and this is another plea for your help, really. Proud to Care will be sending some of you a survey around recruitment and staffing, and this is going to shape how we provide our support or go towards it. So we'd really like to hear how you're faring really around recruitment and staffing and what the difficulties are. I know that time is precious. It will literally take 2 minutes. If you could do that for us, that'd be brilliant. And just to say that the 11th of November is looming, and anybody that feels that they're going to need some support or they have issues around staffing, come the 11th of November, they're anticipating problems, please contact us. We'd like to hear from you and see how we can support you with that. And that's it, Tom.
Brilliant. That was very short, Emma. Thank you.
Very short and succinct.
Short and succinct. So thank you for that.
Lovely. Thank you.
Take a note of those points. And then just quickly on to the WSPiC updates, which I can share a slide for briefly. I'm not looking at the right slide. Now, which screen have you got?
We can see your slide.
Have you got the update slide now?
Yeah.
Perfect. Okay. Am I right in thinking that Juliet is on the call at the moment? And
she is. Yes, she is, Tom.
Going to say a few words? Was that the plan?
Yes, please.
Okay. Over to you, Juliet. We haven't met.
Oh,
so.
Hello. Can I share my screen, Tom? Because
Yes,
I don't think I can
do.
share it at the same time as you.
Yeah, no.
That'd be cool. Okay, lovely. So really, really nice to join you all today. It's been really interesting for me just to find out all the different areas, because obviously I'm new to post and kind of need to know as much as possible. But I just wanted to come along today just to talk to you briefly about some of the work that I've been doing for SCARF and our new project, and just to sort of just give you a general overview about where we are and what we're hoping to achieve from it, and a little bit of background. So I'm going to whiz through these slides because you've had a long morning and I don't want to take up too much more of your time, but this is really just to give you an overview and introduce the programme. So SCARF, Sussex Care Associations, are in our framework. The whole idea behind it is to support the wellbeing of registered managers working in adult social care. And the background to the project really has come from looking at the role of a registered manager. We've got 22,000 or so registered managers and playing an absolute critical role in the adult care sector. Highly committed individuals, who chose to go into the work, many of them for the original idea behind the role. It's a great job, they're passionate about what they do. But the job's challenging and probably never more than it has been over the last 18 months. We know the challenges that people have gone through. And this whole idea of, talking to managers and finding out how they're feeling and what's coming out of that, 50% in a study was shown to be overwhelmed and overworked. 18%, which I query that figure, I think it's probably higher, completely burnt out. Almost 2/3 saying they've received inadequate support in work. We already knew that pre-COVID, the turnover for registered managers was huge. And the idea is that that's going to get, as that's come through today in the presentations, that's going to grow that number. And then we've got 10,000 registered managers that are set to retire in the next 15 years. So that's going to put another pressure on the sector. So the idea, Ruth talked about surveys that she's done with managers, and common themes came out because there is support out there, but the main issue that happened was that managers haven't been accessing the resources that are actually out there for a number of reasons. One that they're feeling overwhelmed by their own services, and doing something else outside that is overwhelming. Also, the idea that a lot of the resources that were available, while some of them are very, very good, they weren't sector-led resources that really focus on specific experience of registered managers. So there was a need to that. And this study just really pulled out all of the things that we need to look at and why this programme is so important. We don't want more managers to leave the sector, and that was very much the feeling of what came across from the surveys. One of the things that came across was actually many managers were waiting for things to settle before they make that move. And we kind of almost feel like we're on the cusp of that now, because the worst of the pandemic being over, and managers have been running on that high level of adrenaline, which is now dissipated and going away. So the proposal for the project was to provide a wellbeing service and I'm not talking about mental health wellbeing service only in isolation, because wellbeing, obviously, we know is about so much more. It's about that whole package of how you feel emotionally, physically, mentally is part of it, but that's not the whole picture. And this project will be aimed at supporting registered managers working in adult care across the services, residential, domiciliary and nursing care. And we're going to promote it widely. And there's a real big drive towards having registered managers to be able to self-refer into the project, because we want it to be owned by them and we want them to see it as a valid and worthwhile thing. So we'll offer a blended delivery of support, which will include a fundamental part will be one-to-one interventions with, I don't like using the word coach, because coach signifies that there needs to be some improvement made. And I don't think that's what we're looking at. What we're looking at is a support mechanism from a professional who understands the kind of processes that people are going through and the things that are going through. And then there will be access to sort of more psychological intervention for those managers who are key at risk of their mental health declining further. So we have our pathway offer, and how it will work is pretty much so we have a referral received. This can be through a professional referral, it can come from a self-referral. That person will be having an individual one-to-one assessment appointment with a coach to...
Sorry to interrupt, Julia. Are we meant to be seeing a PDF pathway?
Has that not shared?
No, not at the moment.
Okay, right, okay. So let me have a look. I will go back to that. Bear with me. Any luck?
Not yet.
Not yet. Okay, well, don't worry. Let's just, I can tell you about the pathway. That's absolutely fine. So the pathway will include an initial meeting with the referee to discuss what what's going on for them at the moment and what parts of the pathway would be useful for them, because everyone won't need the same kind of intervention. There's a range of offer, and people will pick and choose. And what we will do is we will look at the individual parts of that people need. The offer will include, we discussed before, one-to-one intervention, access to wellbeing forums. We want to build up a really good network of support, because the idea is that this is a relatively short programme, and the main purpose behind it is to set up a more robust support system that managers can then access after the programme. And that will tie in very much with the work that Ruth is looking at, because one of the key things will be looking at CPD opportunities moving forward and how managers can kind of develop within their roles, but not develop in terms of improvement, but develop in terms of aspiration and how they're looking at their role and revaluing the role that they do. And I think that's going to be another part of the programme, and also working with Ruth with the CPD, because it's almost like we need to rebrand the registered manager position, because we need to make it more attractive for people. If we're looking at attracting more people back into the sector or attracting new people into the sector, we've certainly got to make it more attractive than it is at the current time, because that won't work. So I think kind of that is where we look at this package that includes, what you will get if you decide to be a registered manager and what's involved in that, and also just to kind of validate the role a little bit more. So there will be challenges. A number of challenges may include low intake initially. How we want to mitigate that is we want to make this really well marketed in the first instance, and also to be endorsed and promoted by stakeholders. We want it to be really responsive. It's a sector-led programme, and we need to promote it sensitively, which is why I really err on the side of not using the word support, because actually we're talking about working with a group of extremely resilient individuals who don't really need to be told that they need to be supported. They need to be valued and recognised. There may be a challenge in meeting demand. The aim of this is to mitigate very early on by building the importance of sustainability through this peer support idea and recognition. And then also looking that not everyone will need the same level of intervention. So this picking and choosing from different elements of the programme will allow us to do that, or to meet need. So aims of the project overall, we want to promote and strengthen the importance of the health and well-being of our registered managers, and in doing that we'll promote the wider workforce capacity and resilience, because we've got well managers, we've got a well-led workforce who are happier at work. We want to prevent the loss of more registered managers from regulated services, and we want to support relevant and empowering CPD offers that really give value added to managers. If we're asking them to do this CPD, there needs to be something in it for them, and I think that's what we need to look at when we're considering the CPD offer. And like I said before, we want to rebrand the registered manager role to encourage experienced members of the profession to stay, and to encourage new registered managers to embrace the role. And I just wanted to end with something positive. I mean, just to remember what the whole idea behind it is. I mean, the manager in registered services, the manager's role, is at the heart of any outstanding service. We know that, leading their teams, promoting excellent care, and it's their values that they promote that make this happen. Those ones that we all know about: dignity, respect, compassion, person-centered care, and they should be valued. And tailor-made programs such as SCARF will hopefully contribute to this. So some contact details, but I'm going to be getting in touch with everybody anyway. Yesterday I sent out the first kind of large scale email, and I'm really pleased that I've already this morning opened my inbox, and there's lots of interest already, so I'm absolutely thrilled with that, and really look forward to working with you all on this sort of critical project. And I'll just end on a happy note. There's a for my dog. Thought you'd all enjoy to see that, and thanks for hearing me, and yeah, I look forward to all working with you all.
Well,